When I got the information from the regional director that one day, as I usually call him, and fondly true, will be leaving, it was really a big jolt because I thought that one day and I will be together for another 1 or 2 years.
Dr. Wande Magegnehu Alemu is the outgoing World Health Organization country representative to Nigeria. Dr. Wande Alemu arrived Nigeria in November 2016 as the WHO country representative. He formally assumed duties on the 15th of December 2016 with the presentation of his letters of commission to Nigeria. His international experience includes working with UNICEF in Ethiopia from 1994 to 1997 and WHO regional office in Harare, Zimbabwe and Brazzaville from 1997 to 2008.
Let me first of all say how much I'm delighted to be given this opportunity to share a few words about my brother, Dr. Wande. Dr. Wande and I, we arrived almost the same week or so in Nigeria, and I keep teasing him that I was his senior until I discovered that he was a bit seniorer than I.
He's been an outstanding public servant, a wonderful person. Very unassuming, hardworking, very approachable, an open-door person who is very humble and therefore very easy to work with.
An Ethiopian national, Dr. Alemu has accumulated 35 years of experience in public health, particularly epidemiology, disease surveillance, prevention and control and health systems, both at technical and managerial levels.
I think my first real recollection of Wande was when we rose together to the challenge of actually putting on the Abuja Walk the Talk to beat NCDs. We had exactly 1 week's notice after Dr. Tedros challenged us when he visited Nigeria. And I was amazed at the close collaboration and the partnership that allowed us to be able to walk with over 2,000 residents of Abuja.
Working with Dr. Wande, for me, embodies that technical support. So a lot of times people use technical support as a punchline, but for me, working with Dr. Wande was a clear demonstration. He lived it, he worked it, he talked about it, and he demonstrated in every opportunity that he had what it means to support government. There was never a time when we reached out to WHO that he did not provide technical support.
Before his reassignment to Nigeria, he served as the WR in Sierra Leone from 2008 to 2013 and Uganda from April 2013 to November 2016. He led and directed the development and implementation of the WHO Regional Integrated Disease Surveillance and Response Strategy in the African region from 1997 to 2008. He led and coordinated development of tools, guides, and protocols on disease surveillance and response.
I knew Dr. Alemu in 2004 when he first introduced the Integrated Disease Surveillance and Response adaptation for Liberia. It was indeed an experience that I learned a lot to introduce a concept that got accepted immediately by the Minister of Health.
I think he brought with him a lot of experience, and he immediately realized that WHO cannot be successful if the country is not succeeding. So Dr. Alemu really quietly but persistently encouraged his team to work with us, has been with us as a partner through all the challenges that we have faced, and we've faced many over the last couple of years. And he has been a source of strength. Personally, but his team as well. And I think the results are there for everyone to see.
Working with Dr. Alemu has been an opportunity, a rewarding opportunity, to work with a colleague who has the commanding experience both for emergency work, for development work.
Prior to the commencement of his international career, he served his country in various capacities, including heading the National Immunization and Prophylaxis Division and Epidemiological Surveillance and Research Division. Dr. Alemu was also involved in the preparation of pandemic influenza preparedness and response plans for the African region, provided technical assistance to countries in the development of national pandemic influenza preparedness and response plans.
We first met in Harare between 2000 and 2005 when he was a regional advisor for IDSR in the African region.
So for me, I think it's very special, my memories with WR, because I welcomed him when he was coming. After a few months, a little bit longer than I had expected, of really serving as an OIC for the office when the previous WR had left. And during those few months, a number of very important things happened, including the starting of the Northeast emergency response and many other things, including the last wild polio sort of response. So I was really looking forward to the WR coming.
Over the last 2 years, we were faced with a wild poliovirus outbreak in Nigeria. After close to 2 years of no cases being reported, it was a very difficult time, and WHO had to rise up to this challenge, re-strategize, move beyond our usual boundaries to address the outbreak in a very complex environment. And with the support of the WR and WHO in general, I must say that we are seeing the impact of the support that was provided.
I do recall within this short time being in Nigeria, there are a lot of humanitarian issues that require attention, require dialogue with the government. And Dr. Alemu had been very instrumental in engaging with the government, in engaging with the partners, in ensuring that we're able to deliver in the line of our emergency work.
Well, I find Dr. Alemu's leadership style quite strategic. His focus is really on providing key guidance and attention to much detail in whatever work that we do with him.
He's a very hard-working person, very focused, and making sure that things are done correctly and well. He does not like shoddy work, he likes quality work, and therefore if you do shoddy work, definitely you quarrel with him.
I do think that within the ability of getting us together every week through the senior management team, but also through technical meetings, I think it's an opportunity that brings everyone together to interact much better in a bigger office like Nigeria. So his qualities, his abilities, his leadership are outstanding.
So he has invested a lot of his time, his energy, his advice to ensure that we work collaboratively across programs. I've given an example of the Northeast work on IDSR, but he's also brought us together to try and see how we can move to revive the work on infection prevention and control, so that we have a common quality of care framework, so that collaborative work. And I think it is laying the foundation for the office as we go towards implementing the next general program of work.
One of the actions that a representative has is the convening power and also engaging partnerships. And Dr. Alemu has done that excellent in Nigeria.
And he has been very helpful in ensuring that partners have a clear message from WHO. And I think it is in his time that we first had a donor event.
It has been exceptional to get the partners together around health, and partners listening, and partners appreciating the work that Dr. Alemu has done. And that's not only within the donors, even within the UN family, they recognize and appreciate his work.
There are areas that we have seen a difference, like communication, resource mobilization, gender issues, which are areas that are cross-cutting.
When you go into a new place, there's always some level of adrenaline, of tension, but he was able to make me relax, feel welcome, and integrate very fast with the team. And I recall one of the colleagues who came into this office on a mission, the way I've been interacting with people just 1 month in my stay this place. I was so free, I was like I had stayed here for a while. So it really boils down to him creating that kind of environment that promotes integration, interpersonal relations, and going beyond even to advise and even consult.
Dr. Alemu made one suggestion to me, which I'll always be grateful for. He said, bring your message for water, sanitation, and hygiene, and we will have our polio vaccinators move that throughout the nation. Now, that took that campaign for me from just being a one-place campaign into a national campaign.
We were hit hard in 2016 with the results of the coverage survey. And again, that called on WHO to relook at how we can adapt our support to address the prevailing challenges, to do things differently, to do things more boldly.
I recall very clearly how he was one of the people that encouraged Nigeria to accept the results of the multi-indicator cluster survey, especially around the low immunization figures, routine immunization figures. And I think that really defined his character in the 18 months or so that I worked with him.
Dr. Wondy Alemu is leaving fond memories with us in Nigeria.
I think I will remember him fondly. When he first came, we spoke on the phone, and I said, oh, I'll be inspecting a primary care center tomorrow. That was a Friday. I told him I would be inspecting the primary care center on a Saturday. And I was shocked when he said, oh, I'll be there with you. And not only was Wondy there, Wondy got there before me.
In all the duty stations I have served before, it's my experience with working with Dr. Wondy as a WR that I will remember as the most fruitful, the most productive, and I think it's to a large extent thanks to his kindness, thanks to his very smooth way of approaching issues. It is also the brotherhood that we managed to build in this 2 years we have served here together in Nigeria.
I think relating to Dr. Alemu's personal leadership style, I have really learned a lot. Dr. Alemu knows when he should put something in an email, when he should write you a text, and when he should call you. And, you know, he understands when to be firm and also when to smile and find ways to resolve issues. We've met many times over lunch or dinner to discuss issues where he felt that an office meeting would not be appropriate for that specific issue. So really I've learned from him to sometimes hold back and look for ways to solve problems. Our goal as leaders is to get a solution, and whether you get that solution through one means or the other sometimes really doesn't matter. The point is to get to a solution.
Apparently, there is the general opinion that he is too young to retire, and truthfully, the nation still needs his level of expertise.
As Dr. Alemu approaches his retirement, I would like to tell him that even though you're retiring from the WHO, I hope you're not going to be retiring from collaborating with me, because I hope that by next year's Abuja Walk the Talk, I hope to have you again with our new country director and you as a very senior expert advisor.
Physically, he's actually stronger than some of us who are younger. And we know that given a chance, we will really need him within the organization. So I'm looking forward that if he's called again to help in one or two areas within the organization, he will be available to help all of us, and especially us young. You know, we are still learning the job to become managers at that level. So we will still expect you to call on him and to call on his wisdom.
Wandi is going to retirement, but certainly that Wandi is not a third person. So I can see Wandi being active at different levels. I also want to prophesy that Wandi will play a major role even in his country, Ethiopia.
It's one global village. It's same issues that we deal with here as it's being dealt with in other countries. The complexities of our work related with the global health security. We need to be building on the expertise of people who have been through this kind of situation, who see the big picture, who connect the dots in different ways. These are the people like the WR that we still need to tap into. And my wish is that WR, you will not retire. Even though officially you're retiring, we still hope that you can make your contribution to public health globally.
It takes public health and health security beyond a career. This is a call to serve humanity.
Of someone who has no Saturday, no Sunday, all he has is commitment to humanity.
He's been one person that will not complete a speech without harping on universal health coverage. And because of the leadership he's provided, because of the wisdom that he's shared, I think Nigeria is a better country in the health space.
And we want to thank you, WR, for being passionate about the work here.
Always it's not easy to say goodbye. But in many occasions, we are just parting. We'll not see him here, but we'll be networking. So as a way of parting with him, I want to say I'd enjoyed, one of the few, or among the many who had enjoyed working with him.
For me is to wish him, and also to wish his wife. She visited here a number of times. To wish also, you know, a good time with the WR, our WR, Wandi.
He lives with a lot of experience working with Nigerians, but he also leaves behind the voice of reason, the voice of support, the voice of wisdom.
Colleagues from the Ministry of Health are very much appreciative of what he has done. One of the things I hear and they continue to mention to me is, we miss Dr. Alemu, and we hope that WHO can give us another Alemu with whom we can work.
We surely miss him, and I wish him all the best as he leaves Nigeria. I'm sure he will still be able to offer quite a lot to humanity. We'll miss him.
Dr. Wandi Alemu, your humble input have made significant difference in the Nigerian health space. We cannot forget you as the new chapter opens for you. We wish you well, our dear Dr. Wandi Alemu.